Now let's move to how we're planning for vaccinating kids ages 5 through 11. We expect the FDA and CDC's decision on Pfizer's COVID-19 vaccine for children ages 5 through 11 in the next couple of weeks. We know millions of parents have been waiting for a COVID-19 vaccine for kids in this age group. And should the FDA and CDC authorize the vaccine, we will be ready to get shots in arms. Kids have different needs than adults, and our operational planning is geared to meet those specific needs, including by offering vaccinations in settings that parents and kids are familiar with and trust. At the same time, we're incorporating best practices and applying lessons we have learned across the past 9 months. Over the past several weeks, we've been working closely with governors, pediatricians, pharmacies, community health centers, rural health centers, and other vaccine providers to prepare for this moment. Together, we're completing the operational planning to ensure vaccinations for kids ages 5 through 11 are available, easy, and convenient. And thanks to President Biden and the resources of the American Rescue Plan, states, tribes, territories will all continue to receive unprecedented levels of federal support, including full reimbursement from the federal government for vaccination operations and outreach programs. I want to highlight progress across a few key operational fronts. First, on supply. We have secured vaccine supply to vaccinate every child ages 5 through 11. And as soon as the vaccine is authorized by the FDA, we will begin shipping millions of doses nationwide. States, tribes, and territories are working to ensure that doses continue to be distributed efficiently and equitably across their jurisdictions. And importantly, we worked with Pfizer to modify the packaging of the pediatric doses to make it easier for pediatricians, family doctors, and other providers to provide vaccines to children. And these vaccine doses will be shipped with all the supplies needed to vaccinate kids, including smaller needles. Next, on getting kids vaccinated. We know parents rely on a range of healthcare providers to meet their children's needs, including pediatricians, family doctors, children's hospitals, pharmacies, and community and rural health centers. We're doing the work to ensure parents will be able to get their kids ages 5 through 11 vaccinated with these trusted providers. We've already enrolled more than 25,000 pediatricians, family doctors, and other primary care providers to administer vaccines. And we're working with states and localities to enroll more. As part of the federal pharmacy program, tens of thousands of local pharmacies across the country will offer vaccinations for kids. And hundreds of community health centers and rural health centers, which serve millions of kids ages 5 through 11 across the country, predominantly in underserved communities, will be ready to vaccinate kids. We're also collaborating with the Children's Hospital Association to work with more than 100 children's hospitals across the country to stand up vaccination sites in their communities. Children's hospitals will partner with local community and faith-based organizations to host vaccination events, including in the evenings and on weekends, so parents can get their kids vaccinated at hours that work for them. And to make vaccinating kids even more convenient, we'll work with state and local education leaders to bring vaccination clinics directly to schools, including by matching pharmacies and other vaccine providers with school districts to set up on-site clinics. By sending vaccines to pediatricians, pharmacies, community health centers, and rural health centers, working with children's hospitals to host vaccination sites, including on nights and weekends, helping schools stand up vaccination clinics, and deploying mobile clinics to meet families where they are, we will ensure that vaccinations for kids ages 5 through 11 are easy, convenient, and accessible to every family.